numbers being witnessed, those that were recorded today. We're also seeing a huge spike, really, from the month of October. This coming about a month since the country was partially reopened. What's happening? What are we witnessing now? Where are we as far as the cycle of COVID-19 is concerned?
Well, Akisa, thanks for having me. Where we are now, as you pointed out, we're seeing the numbers going up. But if you actually look at the spread across the country, the numbers are going up more in the other counties than they are going in Nairobi. Nairobi was obviously one of the first landing points for COVID. And we saw Nairobi and Mombasa contributed a huge percentage of the total curve of the country. But now we are seeing numbers rising in what I like to call the second-generation urban centers. That would be Nakuru, Eldoret, Kisumu, and also as kind of a second acceleration in Mombasa. So we are seeing the spread across the country, and that's therefore kind of a delayed response from the counties. So we are seeing that now being picked up. So that's what we are seeing as expected. So we are seeing there's a small rise in Nairobi, but the bigger rise is actually in the counties outside Nairobi.
For months, we prepared the counties. We talked about preparedness of these counties, before movement was reopened from the city, especially Nairobi and Mombasa, to other counties. Has the months of preparations meant anything for Kenyans and for these counties?
Yes, they have. Yes, they have. I think there are two areas of preparedness. The first side of preparedness is surveillance. It's being able to ensure that you have enough capacity of health workers, you have PPEs, you have actually done communication and awareness to the public of preparedness, that people are washing their hands with water and soap, and you have enough PPEs to protect your health. But the second level is that you're actually able to identify the people infected and trace the contacts. And when you find the contacts, you isolate them or quarantine them, depending on where they are. If they're able to isolate at home, they isolate at home. If not, that you have enough isolation beds for those who can't isolate themselves at home. And what I know is that, the counties did put up significant capacity for the isolation. What I'm not sure is whether there is enough capacity for surveillance, for contact tracing. Now, the other preparedness is about testing. We know that the country has expanded, what I've seen, expanded the capacity to test, quite drastically. When we started, we had only 1 or 2 centers in March. Now, I think we have up to maybe 40 or so centers that are able to test. The question is, within the counties, there are many counties that still don't have capacity to test, and therefore they have to send their samples to the centers that are testing, and that means there could be delay in receipt of samples and in receipt of test results, which then creates that delay in between, and that delay then could result in demotivation, delayed in action, because if you are testing somebody and then you have to go and follow up, their contacts, and you're getting the results 10 to 14 days later, it may be too late for you to then trace the contact. So I'm not sure that we build enough capacity for that testing and surveillance. But then the final preparedness about being able to take care of people who are unwell, people who are symptomatic and need medical attention, like oxygen, beds, ICU beds. And there was some buildup of capacity, but I'm not sure it's adequate based on the numbers we are seeing now.
Then that really does bring me to the next question. We are seeing our healthcare system slowly getting overwhelmed. When talking about bed capacity, ICU, it would appear that we are stretched. So where do we go from here? The numbers are going up, our hospitals are stretched, a lot more patients on home-based care. But what happens when it's severe? Where do we go from here?
What we need to do is really focus a lot on the surveillance part of it, because we need to know exactly who is infected, who have they been in contact with, and who do we need to isolate. And if you don't have the test yet or the results yet, who do you need to quarantine? That's critical, because now Akisa, that we have widespread community transmission. So testing, surveillance, and tracing is really, really critical in this phase. Because if you're not tracing and testing and isolating, then we are flying in the dark. That's really critical. The next thing is to ensure that we continue to increase the capacity of the health system. You know, we have seen the president launch the universal health coverage, scheme, but we must accelerate the health system investment so that we have oxygen, not only in the COVID centers, but we have oxygen in the health centers. We are able to test how much oxygen people have when they come to the hospital in the dispensary. That's what we call pulse oximetry. These are small gadgets. So we must build the health system capacity. We must ensure that health workers are adequately protected. But also, as we do these things, we must consider measures that take back the force of transmission. These measures that take back the force of transmission may include some taking back maybe the hours on the curfew, maybe some more limitations on social gatherings, some more limitations on social activity in the bars and restaurants. How that happens while still maintaining full economic activity is, I think, the challenge that we must look at and use science to determine the best. But we must take back a little bit so that we have time to do this rebuilding so that we actually allow capacity to be built to continue. This is what you have to do. You let go, then you take back, you let go and take back until you have a...
All right. And Gitari, I want you to comment on two things, the political gatherings we're seeing and how churches are handling this. But before that, let's quickly take this story. Churches are on high alert amid the swelling numbers of coronavirus.